16 of 2023, laid on the table of the House on Wednesday, 11th October 2023, and approves the mediated version of the Public Finance Management Amendment Bill, National Assembly Bill number 16 of 2023. As members of that opinion say aye. Aye. Those of the contrary opinion say nay. The ayes have it. Thank you. Next order.
Order number 13, the Facilities Improvement Financing Bill, Senate Bill number 43 of 2023, second reading.
Majority Leader.
Thank you, Honorable Speaker, and I beg to move that the Facilities Improvement Financing Bill, Senate Bill number 43 of 2023, be now read a second time. Honorable Speaker, this is part of the health amendment bills, part of the 4 amendment bills that have been considered by both houses of parliament, and this is one of the 2 bills that emanated or was initiated from the Senate. And Honorable Speaker, as members are aware that most of our public facilities suffer from the lack of financial autonomy and also, Honorable Speaker, not just financial autonomy but also managerial autonomy, many of them being public entities that fall under either county governments or operate as parastatals like the national referral hospitals. And because of this lack of autonomy at managerial and financial level, we have seen an increasing fragmentation of health facilities and poor service delivery, both at the local and also at the national level, decreased efficiency and a lack of financial risk protection and transparency and accountability in how many of our public health facilities are managed. Honorable Speaker, therefore, this bill seeks to cure some of these problems by providing financial and managerial autonomy and accountability with the aim of improving decision-making right from the primary health care facilities at the sub-county and ward level all the way to the national referral hospitals, the level 3, the level 4 and 5, and level 6 hospitals, Honorable Speaker. This bill, Honorable Speaker, also aims to stimulate increased revenue collection by public health facilities, significantly contributing to the realization of the universal health coverage target on expenditure and on healthcare infrastructure throughout the country. Honorable Speaker, with the enactment and possible approval of this bill, Honorable Speaker, the healthcare facilities right from the village dispensaries will not only enjoy financial autonomy and managerial autonomy in their management, but also will have a stimulated sense of revenue collection, and they will be able also to retain part of the revenue that they generate at the local level to enable them to provide services and more efficient services to the people that they serve in the localities. This bill, Honorable Speaker, also ring fences money that is generated by public health facilities, as I said, ensuring that there is a predictable and regular and steady source of funding for public health facility operations in the counties. And Honorable Speaker, you know, the problem that has bedeviled many of our healthcare facilities, and many members who have health centers, both at level 2, level 3 health centers, know that many of them will even charge user fees. They will charge a little bit of consultation fees, but all this money previously has been going to the county revenue accounts and not getting back to these facilities. And with this bill, or with the enactment of this bill, this money will now be ring-fenced, that a facility that has collected money at that level will be able to have part of that money retained at the local level to ensure that they are able probably even to buy certain basic medical, either medical pharmaceutical equipment or non-pharmaceutical equipment or pharmaceuticals, Honorable Speaker, to be able to ensure that their clients or their patients who they're attending to are attended to with all requisite equipment and pharmaceuticals available at that local level. And the problem, Honorable Speaker, has been that facilities having to wait for either the county governments at the county headquarters to send them back money to buy even basic things like bandages, or even cleaning equipment, or even gloves. Honorable Speaker, you remember during COVID, many facilities in our local areas could not even access gloves or even face masks, Honorable Speaker, for people who were being exposed to the vagaries of being infected with the COVID pandemic. And now, Honorable Speaker, with the enactment of this bill, facilities, medical care facilities, with the monies that they retain, they will be able to have that managerial and financial autonomy to ensure that a medical superintendent or a medical officer who has been appointed as an AIE holder at that local dispensary is able to incur expenditure and procure for whatever they need to be able to ensure that indeed universal health coverage becomes a reality and we improve on affordable health care being available to our people. Honorable Speaker, other objects of this bill, Honorable Speaker, as I mentioned earlier, is to provide an efficient, secure, and accountable mechanism for the collection, the retention, and management of revenue derived from health services rendered at public health facilities in Kenya. And therefore, Honorable Speaker, I don't think I need to overemphasize that. It's just what I was explaining, that the facilities will efficiently secure, collect revenue, and they'll be able to manage that revenue themselves at that local level. Two, Honorable Speaker, is to establish a governance framework that will facilitate effective planning, coordination, mobilization, and access of public health facilities improvement financing in Kenya. Honorable Speaker, as I mentioned, because of the challenges with healthcare facilities accessing funds, either funds being appropriated at the national level or even at the county government level, they have not been able to have a very good governance framework, and now they will be able to do that with the enactment of this bill. Thirdly, Honorable Speaker, is to provide for the appropriation, management, and use of retained health services revenue to supplement operations and facilitate quality service delivery in public health facilities. Honorable Speaker, as I had said, that they will now be able, money that has been appropriated to these healthcare facilities will be able to be retained there, and they will be able to supplement on operations and facilitate the quality provision of affordable and quality healthcare services to patients or to members of the public. Fourthly, Honorable Speaker, is to promote equitable health facilities improvement financing, including benefit sharing in accordance with the relevant laws of Kenya. And Honorable Speaker, you are aware that many facilities across our country do not enjoy the same level of equitable share of resources. And with this particular bill, Honorable Speaker, we shall be promoting an equitable health facilities improvement financing, where all facilities with the ability to generate revenue are able to retain their revenue and be able to manage the kind of medical care services that they give to the public at their local level. Honorable Speaker, this bill will, in the fifth instance, provide for a unified system to guide financial management in public health facilities, improving efficiency and effectiveness in the, and ultimately quality health service delivery. Honorable Speaker, this unified system will be across the country, and it will not matter whether it is a health facility in Elwak, or a health facility in Karachuonyo, or a health facility in Deya in Kikuyu, or even one in Mukurweini in Nyeri, or one in Shinyalu constituency. Honorable Speaker, all our healthcare facilities will have the same architecture in terms of their financial management of how they are financed and how they are managed, Honorable Speaker. This bill will also empower our local communities, Honorable Speaker, because there will be management boards and management committees that will manage local hospitals at the local level. And therefore, people will have some sense of ownership of the facilities that are in their neighborhoods, and ensuring that there is also accountability and transparency in how we not only finance but manage our own healthcare facilities. Honorable Speaker, the bill also makes provision for the retention, as I said, of public health facilities, improvement financing, as well as the purposes for which these retained finances will be utilized. And the bill, Honorable Speaker, when members peruse through, will be able to see that the bill is providing not just on how much you can retain and how these facilities will be able to retain part of the revenues they raise, either in own source revenue or what has been appropriated by the county governments, or even from grants and donations or gifts, but also for what purposes can health care facilities utilize the monies or the funds that they have retained at that local level. Again, as I mentioned, Honorable Speaker, to ensure that there is a lot of transparency and accountability to ensure that those officers who will be designated by the chief officers in charge of healthcare at the county level, who are the accounting officers for these healthcare facilities. And because the bill also gives the chief officers at the county level powers to designate certain officers as AIE holders or to have the authority to incur expenditure at that local level, be it a medical superintendent or whatever level of health officer is charged with that responsibility to incur expenditure, that they do so in a manner that is accountable, and they know by law what is it that you can utilize this money for, so that we don't have instances, as has been happening, Honorable Speaker, where money is collected from our healthcare facilities, and instead of this money being plowed back to improve on healthcare provision at the local level, this money is diverted to go and construct roads. Other money is diverted to go and provide bursaries to school children. Honorable Speaker, it will now be imperative that even at that local level, the officer in charge, who is an AIE holder, knows by law what is it that I can utilize this money for. And therefore, they will not use the money for gardening and construction of hospital gates when the hospital wards are in deplorable states or there is no medicine in the healthcare facilities. Honorable Speaker, lastly, this bill, because I don't want to go into all the provisions, this bill has close to 27 clauses, but the last part, part 3, is the role of the national government, and that's what this bill speaks to in terms of the national government's role in policy formulation, research and development of to improvement financing. And the Cabinet Secretary has been given certain key responsibilities and in terms of developing policy guidelines, how the facilities will be able to account for the money that they generate in a more transparent and accountable manner, use it prudently, how they collect, receive, collect, and also analyze data for facility improvement financing, policy formulation and support, Honorable Speaker, so that at the ministerial level, the minister will be able to formulate policy on how government can be able to collect information, receive and collect data, or even analyze such data as to how government can help the counties to improve on their facilities financing. And Honorable Speaker, of course, Honorable Speaker, amongst all the other provisions which I don't need to go through in the bill, or other responsibilities of the Cabinet Secretary in terms of formulating policies, because we know, Honorable Speaker, that healthcare is a devolved function, and that is why, in recognition of that particular fact, that the healthcare provision is a devolved function under Schedule 4 of our Constitution, most of the policy formulation work is being left to the minister at the national level. But in terms of management of the lower level facilities, that will be done at the facility level, Honorable Speaker. Honorable Speaker, let me not go through all the provisions, but encourage members that this is indeed part of the health care amendment bills, the 4 bills that I mentioned, that will be a game changer in how we manage healthcare facilities in our country and how we actualize universal health coverage to millions of our people who have suffered over the years due to lack of accessible, affordable, and quality health care. That finally, Honorable Speaker, we'll be able to crack what has escaped us for many years in terms of provision of universal health coverage, and towards realization of Article 43.1 on provision of affordable, easily accessible, quality healthcare for millions of our people. And I want to believe, Honorable Speaker, that all of us will now rise to the occasion, support these bills, this together with the primary healthcare bill that is also listed as order number 14, Honorable Speaker, together with the two other bills that emanated from this House and that have been considered in the Senate, will be that game changer that will make sure that we completely change the architecture of how we manage and provide health care to millions of our people. And Honorable Speaker, as I said, as I moved the other two bills, Honorable Speaker, many members of this House, and indeed even in the Senate, and even our governors and MCAs will tell you that one of, other than education, the second is actually the primary burden to millions of our people in our constituencies is the cost of health care. And Honorable Speaker, if we are able to deal with effectively with the cost of health care so that our people are able to access affordable and quality health care at the local level, Honorable Speaker, we will be saving millions of our people from a burden that many families have had to bear with. Many families have been rendered destitute because of healthcare bills and illnesses and sickness in their families. A member of your family falls sick and you simply cannot afford. And Honorable Speaker, even members of parliament, and I know many Kenyans assume members of parliament have all the money to cater for their own healthcare bills, those of their families and their constituents. Honorable Speaker, all these members of parliament here will tell you that every Monday or Friday when they're in their constituencies, the number of fundraisers they are being invited to on account of medical care are unmanageable for them. And members of public, Honorable Speaker, will not even understand that the role of providing health care is now devolved, belongs to the governors and the county governments, and they all walk to offices looking for help. And understandably, Honorable Speaker, Kenyans are desperate for affordable health care, and we cannot afford to finance their health care from our pockets. But by working together collectively as a nation, as leaders, we can be able to enact this kind of laws that will completely change how we manage our healthcare facilities, how we manage our primary health care, how we finance our health care through the social health insurance fund that we approved here the other week, Honorable Speaker, and completely change the architecture of how health care is dealt with in this country, and therefore effectively deal with the cost of living. And Honorable Speaker, when you speak about the cost of living, many people assume the cost of living is a matter to do with just food and provision of affordable food. But the cost of healthcare, Honorable Speaker, is a major element in the cost of living. Because if we save Kenyans from the high cost of medical care, Honorable Speaker, they will have higher disposable income available to them to cater for their other needs, be it education or food. And therefore, Honorable Speaker, I beg to move and request members to join us or join me and the drafters of this bill in the Ministry of Health, plus the other bills, to bring down the cost of living for millions of our people. Honorable Speaker, with that, I beg for your support, and I beg to move and request the chair of the Health Committee, the Honorable Pukose, to second, as I thank the Honorable Pukose and the Health Committee for the immense work they did to take these bills through public participation in the 7 days that were designated and be able to come up with the report that they tabled this afternoon, Honorable Speaker. Thank you.
Thank you. The Honorable Pukose.
Honorable Speaker, I want to thank the Majority Leader and second this bill, the Facility Improvement Finance Bill number 43 of 2023. Let me begin by thanking the members of the Health Committee that I chair for their dedication in preparing and tabling of the committee report on the bill.